Hi, today we're going to be going over heat therapy for sickle cell warriors. These are some safe practices for pain relief. I'm Whitney, your community health worker at Red Stick Sickle Cell, and also a patient advocate and sickle cell warrior. So we're going to talk about the benefits of heat therapy. It increases blood circulation. It can help with detox, and it also most definitely can help with pain relief. So, as I said, it increases circulation. It increases that blood flow. Heat therapy dilates blood vessels, promoting better circulation in painful areas. So, I know living with sickle cell, I utilize a heating pad because that is my best friend. Also, heat therapy relieves muscle stiffness. It helps relax tight and stiff muscles, improving mobility and reducing discomfort. Also, it eases pain. Heat therapy eases pain. The heat can block pain receptors and calm irritated nerves, reducing overall pain intensity. So, what are some types of heat therapy, you may ask? As I stated, heating pads, that is a form of dry heat. Heating wraps, this type of heat draws moisture from the skin, but can be easily or easier to apply or more convenient for a day-to-day use. Now, moist heat, this type of heat therapy includes adding moisture to the application, like a warm bath or steam towel or moist heating pads. Typically, I know when you go and get a pedicure from the Asians or the nail shop, they typically, when they do your pedicure, they wrap your leg with that hot towel. That's the type of moist therapy, heat therapy, because they then, follow with the massage and all of that. So that's improving circulation and all of that. And it also relaxes your muscles and in your legs, and it helps, just overall helps. But that's just an example of what I wanted to say as it related to types of heat therapy. Let's move along. Tools and methods for applying heat. So we want to always be careful when we're applying heat to our skin because our skin can be burned. So you want to make sure that you're applying heat properly. Electric heating pads. This is a common and convenient tool, and it is the most common one. I'm gonna just say that in the sickle cell community. So make sure that your temperature is adjusted and it has an automatic shut off feature. Moist heat compresses. So I used to have this bag, this bean bag, rice bag. Sometimes I used to heat it. Sometimes I used to wet it. So it can be used as a moist heated compress. That was microwavable. It can be put in the microwave, and some heat compresses you do microwave or you snap, and normally the heat is there, and then eventually it wears off. So these can be made by wetting a towel with warm water. You can make this at home and just applying it to the painful area. So you can get a heavy towel, wetted, not too big, not too small, just a towel big enough to place on the area where you are in pain, jointed area, and make sure it's as hot as you can stand it. Me, I like hot temperatures, but I do I am mindful of what, you know, type of therapy or heat compresses I put on my skin. Warm baths or showers. I love a warm shower. I love a hot shower. I'm sorry. It's so relaxing, so therapeutic. So it does apply like a heating sensation of full body heat. So, adding Epsom salts and essential oils can enhance the experience. I know that I get those Epsom salts by Dr. Teal's, and I get the eucalyptus, lavender, all of those scents that help with promoting relaxation. And you can create a more therapeutic aroma and aura when you're relaxing. That helps too. Warm wraps, so we can wrap your arms, you can on the go relief, kind of like those icy hot patches or those warm wraps where you can put a heating pack on and wrap it. That way it won't burn your skin and eventually it'll wear off, but just be mindful sometimes those heating packs can cause skin damage. But that is great for on the relief, on the go relief, I'm sorry. Especially during a pain crisis or in a cold environment when it gets cold. Those are good to place inside your jackets just to keep you warm, to help prevent a pain crisis as well. So these are some safe practices for using heat therapy. So to ensure that you get the most out of heat therapy without risking injury or discomfort, we just ask that you follow these guidelines, okay? And consult your medical professional as well. I'm not a medical professional, but I am a community health worker and I do like to keep you educated and updated on the most recent updates. So temperature control, always keep the heat at a moderate level. Avoid high temperatures to prevent burns or skin irritation. So aim for warm, not hot. Limit the time that you use the heat, no longer than 15 or 20 minutes at a time. Extended heat exposure can lead to burns or skin damage, as I stated. So monitor your skin. Check your skin every 5 to 10 minutes to ensure it's not getting too red or irritated. And hydrate. As a sickle cell warrior, this is always number one. But when you're applying and using heat therapy, please remember that you always need to drink plenty of water while using heat therapy to prevent dehydration, especially when you're using dry heat. So when not to use heat therapy, in most cases, we think that it's, oh, yeah, it's not gonna, not gonna hurt. But sometimes it is appropriate to use hot therapy, heat therapy, or cold therapy, ice therapy. Okay, so in these cases, hot or heated therapy may not be appropriate. So avoid using heat therapy in the following situations. So we want to avoid heat when we're having an infection. So do not apply heat to areas with infections like open sores or ulcers, as heat can exacerbate these issues. It can accelerate them. So next, acute injuries. If you have a new injury and it involves swelling like sprains, do not use heat therapy. As opposed, please go to cold therapy instead. As a massage therapist, I do know like on sprains and things that are um, twisted or pulled, it's more of an ice therapy, cold therapy that helps the muscle repair. You see that mostly in athletic facilities, they will ice the spring. Fever, avoid using heat when you're running a fever because it can raise your body temperature. I, for one, can attest to that. I thought I was helping, but I wasn't. I got an infection internally, and at one point it was horrible. I put the heating pad on, and I was so cold. You know, typically when you have a infection somewhere, your body temperature it fluctuates, and you get cold. And I use the heating pad to warm myself up, and it was raising my fever. I went to the ER with a 103 fever, and I was monitored overnight. So avoid using heat therapy when you have a fever, when you have acute injuries, and when you have infections. So incorporating heat therapy into your routine. So for daily use for chronic pain, use heat therapy during like routine times, like set a time in the morning to reduce stiffness when you're getting out of bed. I know sometimes I use heat therapy in the morning because that's when I'm the most stiffest. After a great night's sleep, I wake up stiff. That's crazy. And before bed, it relaxes your muscles and it can help to, drift you off to sleep. So during a pain crisis, if you feel a pain crisis coming on, using heat therapy early can help manage the severity of pain. I can attest to that as well. When I feel my body telling me, Whitney, slow down, or, this knee has been aching for, on and off a couple days now. I start incorporating heat therapy in my routine because something is causing strenuously somewhere is causing my joints to ache. It could be the seasons change, but I try to apply heat therapy throughout the day or, take a warm shower, hot shower throughout the day just to help decrease the severity of pain I may feel later. So combining with other therapies. So heat therapy can be combined with light stretching, massage, and relaxation techniques like deep breathing to amplify its effects. So that's one reason, a fun fact about me, that's one reason why I, as a sickle cell warrior, took upon massage therapy back when I was learning more and I was transitioning into adult care. And also, there were other reasons I took upon that trade because I didn't want to just look towards the factor of Western medicine helping. I know there's holistic approaches, there's also therapeutic approaches, but there's different forms of therapeutic approaches that you can use when living with sickle cell. And it's not too straining on your body and it's not too damaging to your body as well. Massage therapy helps a lot in so many ways. I'll do a series on that as well and share some things that I've learned with you guys so it can help you in your everyday routine. So you want to always have a heat therapy safety checklist before using heat therapy. Now you can do this at home, but you always want to practice safety. Safety is always important. So ask yourself these questions when you're thinking about applying heat therapy. Is the heating pad or compress set to safe or set to a safe, comfortable temperature? Have you set a time limit to use your heating pad 15 to 20 minutes at a time? I know sometimes you get so relaxed. I've even fallen asleep with the heating pad on me. Thank God my husband was there. can we move this? Can we? He's so hands-on when it comes to caring about me when I get a crisis and when a crisis is coming on. Tell him anytime, babe, I feel my back hurting. I feel my joints hurting, my knees. He get the heating pad, sets it up. If it gets too hot, he turns it off. So I don't have to automatically have a switch, but if you have a switch that shuts off, that's A1. That's a A1 heating pad. Some heating pads don't automatically shut off, but you should have a timer on your heating pad. So are you monitoring your skin for any signs of irritation or discomfort? I know sometimes it doesn't appear always, but sometimes after prolonged use, you'll start seeing some irritation in that same area. If you're utilizing it or applying it to the same area multiple times, try to be careful. Sometimes you can apply a towel and then the heating pad. Some heating pads have covers. So try to avoid, extra or prolonged exposure to your skin at high temperatures. And am I properly hydrated? Have I been drinking enough water? Have I been hydrating myself? So you want to make sure that you're properly hydrating before using heat therapy. So these are some recommended products. As you know, a heating pad, electric heating pads, make sure those adjustable temperature controls and an automatic shut off. I know sometimes there are on a, more expensive side, but it's necessary and it's beneficial. And ultimately it's a go-to when you are at home, trying to control your pain as opposed to going out to the ER. Well, this can help the severity of the pain. And moist heating pads, the ones you can microwave, those are DIY. You can do them yourself at home. If you have some towels, if you have a compress, if you have a weighted blanket, if you have something that can be wet, I wouldn't suggest a heated blanket or a weighted blanket. But I would suggest something smaller, like a hand towel or a washcloth, something that you can possibly put um water on, or you can fold it up with it and put it in, like you heat it up and then put it in a Ziploc bag, and just look at some DIY moist heating pad ideas. I know that there's some out there. Epsom salt. So try to add those to your bath. So it promotes relaxation and it helps with muscle release. So in conclusion, heat therapy is a powerful tool in managing the pain and stiffness associated with sickle cell disease. By following the tips and safety guidelines in this guide, you can use heat therapy effectively to enhance the quality of life and stay in control of your pain. So for more information and resources, visit our website, www.warriorspeakout.com. There's newsletters, there's forums, there's a lot of information on the website that you can go check out. And be sure to stay warm, stay safe this holiday season, and stay strong, warriors. We're in this together.